few minutes late.
Yeah, I'm done.
I'm just starting the movie, man.
So let's go ahead and get started. Did you say you had something for me to follow up? I thought you had said that in the
Yes,
leadership.
I did, but less for follow-up, more for going forward. So just a couple of things, council, in speaking with the mayor and vice mayor, you'll note on your March 3rd upcoming agenda, we're making a small change to take anything that is $500,000 or greater of city expense and put it on the non-consent agenda as just a routine matter. So you may see that popping up starting on March 3rd. We'll also have a quick pre-meeting on the federal earmark projects that we've identified. And then I wanted to just draw your attention in case you notice on March 3rd, the authorizing of an amendment to the water rate adjustment to let you know that that item is just to correct a scrivener's error, an oversight. There's nothing substantive. So when you see that, don't worry that there's something money issue coming forward. There is not. And then lastly, you'll see the capital budget review is coming up on March 10th. We will bring 2 memos to give you a bit deeper dive as part of that work session into the business center and also into the Fire Station 1 project and sharing what we know about both of those projects at this time. So that'll be coming, and it's not apparent in the title, but it will be part of it. And I believe everything I have. You asked a question, just one more thing about the police department and mobile crisis unit, and Chief Cheney has included a memo in your packet. So if you have questions after that, feel free to reach out.
Awesome, thank you.
Welcome.
Any other meeting follow-up that anybody would like to speak? Okay, let's go ahead and start with our first item, peace in our cities.
Thank you, Mayor. I can maybe
Yeah,
tee it up
would you
very
tee that,
quickly.
please? That'd be great.
Mayor, Council, so back in December, there was a presentation from the team that went to Edmonton with some of their takeaways and key points that they learned during that visit. Council seemed to express the most interest in taking a deeper dive with regard to 24/7 crisis response. It just so happens that CWCC, along with several other nonprofit and local government partners, have been working on standing up a mobile crisis unit. So rather than coming back and starting from scratch, the group has been working together to really present to you tonight kind of the state of those efforts and some steps forward to build that program out, as well as a little bit of a discussion around some of the other efforts that kind of feed into that effort. So without further ado, I'll turn it over to Jayla Sutherland, who headed up the group to Edmonton, and she'll take us through the presentation. Hi, Jay.
Hi, Mayor, City Manager, Council. Hi, everyone. Good to see you again. I think, Eric, the attorney, Mr. Attorney, I think you covered a lot of what I was going to talk about, just kind of reminding how we have come to this point. So just as a quick reminder, the city of Casper joined Peace in Our Cities last year as part of its commitment to working on violence reduction in the community. Peace in Our Cities isn't necessarily there to start new programming that is Peace in Our Cities branded, but it's there as a partner and a supporter and a connector when it comes to helping communities meet their goals around violence reduction. So 2 of the main goals that we've heard and that have been discussed here in Casper are related to youth violence and community violence. And part of one of the programs that Peace in Our Cities offers is the City Exchange program. So as you have in your packet, there's the report from the City Exchange that took place in Edmonton last year. And since then, the group of us that went and additional local partners have been meeting to try to understand what was learned, what key takeaways were there, and what might be able to move forward here in Casper. So the program and the ideas that we're here to discuss today are really related to community violence and mobile crisis response that is that is both preventive and responsive to violence and behavioral health issues in the community. There are ongoing efforts related to youth violence, but those are in different stages of readiness for understanding partnership and understanding in particular the role of the city. So it's not that there's not room to move forward on that. It's just that it's a different stage in development. So I actually don't have a lot more to say. I will just end with introducing that we've been trying to kind of come up with a bit of a framework for how to understand the ways that the mobile crisis unit will support our community. You've obviously seen that there's strong support from the police department to partner with a response unit like this and the positive ways that that impacts both their ability to focus on the strengths that they have, but also to really meet the actual needs of those who are in crisis. And so the framework that we've come up with is kind of 3 tiers, 3 levels. The first is really focused on deflecting and outreach response, which is really more on the prevention spectrum. And then the second 2 deal more with response and how a mobile crisis unit can work with city entities and also community entities to really respond and meet the needs of our citizens and to help make this community safer and stronger. So with that, I will stop and I believe you're up next. And then we also will have other partners who are here and available to answer questions too once we kind of get through our spiel here. So thanks for having us back.
Hello. Hi, I'm Kelly Wessels. I'm with Community Action Partnership, but I'm also representing Anna Kinder from the Community Health Department because she is unable to be with us tonight. And we've been working on a system level of level 1, deflection and outreach response, which is a more simplistic and doable right now type of activity. The purpose is that at level 1 that it establishes a more proactive prevention, first line kind of community safety and health model. It's outreach, but with some additional benefits. And Casper's not starting at 0. The infrastructure actually does exist between several agencies. It's creating the alignment of those agencies that we're working at this current time in order to be able to deploy it correctly. And this was something that they saw in Edmonton. I happen to be familiar with the Alberta model, so they're very similar. And we have an operating living system right now of assets, community health workers, peer navigators with lived experience, embedded outreach workers, a functional mobile unit that I have under my agency, which for healthcare for the homeless, coordinated supplies, and we have good trauma-informed expertise. We also by partnering with public safety partners, we have an ability to achieve a different level of stabilization out in the field. So it's not conceptual capacity that we're talking about at this point in level 1, it's actually operational capacity. And the opportunity is the alignment. Prevention replaces reaction and stability replaces crisis. So when you go out and you're actually meeting people where they're at, which is what exactly engagement looks like, is that community health workers and teams of CHWs, peer navigators, and public safety entities can go out and see people right on the street right now. Meet them where they're at, have a conversation, provide maybe a meal, and look at some health assessment in real time. It's an ability to provide some things in time to relationship build and be proactive in our intervention aspects rather than having to be reactive. It has not happened. We are now just wrapping around that opportunity because we have the assets to deploy. And we're already doing it independently, so we will be much more powerful when we do it together. Some of the things that we get to do is that it also provides an opportunity to change the narrative on public safety representation, to make them more of a part of a relationship building rather than just seen as a punitive response in a very early stage. warm handoffs to other providers in the community you just haven't made it to yet. Follow-up and continuity, looking at this as a real continuum of care. And the success, programs don't change systems. Aligned structures do, culture and execution. So success is going to depend on coordinated governance among all of us, shared data, looking at what's trending, where is it trending at, what can we get ahead of, what is not our lane, and what is somebody else's lane, and how that can manage within this level 1 area. Casper's a unique area because it does have a lot of the tools. It has the trust, and it has credibility among its partners. And I think that we've seen this where we're having this discussion within the Natrona Council on Safety of Justice, is that we really have an opportunity to just do this now and set the stage and take care of some of the lower level issues so that mobile crisis can really be invested in and be invested in to the level that will provide the quality that mobile crisis needs at level 2. So we do not see this as, these are different stages, they are different, they have different outcomes. But it is a stage that's important so that the other can flourish and be a real community asset.
Any questions for Kelly? Joy, I think I forgot to ask if anybody had any questions for you. I apologize. I didn't mean to slight you. Any questions for Kelly? Okay.
Good.
Thank you so much. For
Not yet.
Not yet. Maybe we'll bring you back up here. Thank you.
I'm Jim Kauser. I'm the CEO at Central Wyoming Counseling Center. We are the community behavioral health center for Natrona County. With me is Jason Merrick. He's the program supervisor for our mobile crisis team. We wanted to share with you what current state is, what our horizon is, and what our goals are. As Kelly stated about alignment, is also optimal execution of response. So currently we have Monday through Friday from 10 a.m. to 10 p.m. a response team available with the unit. Our goal in 3 months is to have 7 days a week of response during that 10 to 10 window, and also forming a partnership with Casper Fire EMS, similar to our partnership with Casper PD and the Natrona County Sheriff with CIT teams, in being able to explore a community paramedicine model that our mental health workers would be able to respond along with a community paramedic and address issues to triage, to deflect from the emergency department, deflect from officers having to take people in and sit with them, be off patrol, and to look at cost savings to both the individual as well as the community. So there's a little bit of statistics in this as well. I know we're short on time, so I want to make sure that you've got something to look over. And Jason's here with me to be able to answer some day-to-day operational questions. You want to come up with me,
Hello. Mr. Mayor, council members, thank you for the opportunity to speak with you tonight. Central Wyoming Counseling Center provides rapid community-based crisis intervention services throughout Natrona County through our Mobile Crisis Response Team, or MCRT. Our team is comprised of behavioral health professionals trained to respond in the community and de-escalate crises that are related to mental health conditions, substance use disorders, alcohol or drug-related behavioral health crises. Our mission is simple: provide immediate behavioral health intervention while reducing unnecessary emergency department visits and law enforcement involvement. CWCC serves as the lead partner for Level 2 Behavioral Health Mobile Crisis. Our primary function is on-scene behavioral health and substance use assessment, crisis stabilization, rapid response when mental health support is needed, deflection from emergency departments and jail. Operations, we operate independently alongside Level 1 outreach, direct referral pathways from Level 1 teams or dispatch, and we co-respond and or escalation to EMS or law enforcement when appropriate. Some of our key outcomes have been immediate behavioral health intervention, reduced unnecessary emergency department visits, and reduced law enforcement involvement. Our team operates daily from 10 a.m. to 8 p.m. Community members, providers, and partners can call 307-337-8842 24 hours a day to connect with the team. Every call is screened for risk and safety. We respond to behavioral health crisis calls that do not involve medical emergencies, weapons, or known threats of violence. If those are present, 911 remains appropriate. Our team can stabilize the crisis through intervention and de-escalation, provide transportation to behavioral health services, connect individuals to community resources, and coordinate initial treatment services. We are not an emergency response agency. We are a clinical behavioral health response system designed to fill the gap before crisis becomes incarceration or hospitalization. For September through today, we've seen, as far as our outreach goes, we've seen in September, we saw 1 outreach, October, November, December, all 2 outreaches per month. January, we saw 6 outreaches, and this month so far, we've had 2. We have proactively communicated with providers to ensure availability for mobile clinic outreach opportunities, and this reflects our relationship building, our education, and early intervention, preventing escalation before crisis response is needed. Our call volume has been 60 actual mobile crisis calls since October. As you can see, it's been trending upward ever since October when we started tracking to reach its peak in last month at 19. And so far this month, we're at 8 calls. We saw steady growth from fall into winter, and January representing our highest utilization month. The trend reflects increased community awareness and growing trust in the program. Transport activity. In addition to crisis stabilization, our team provided multiple transports to appropriate behavioral health services. The transports represent diversion from emergency departments, diversion from jail, safe placement into treatment, and reduced burden on law enforcement. The system impact. The mobile crisis response team helps the city of Casper by providing immediate on-scene behavioral health intervention, reducing unnecessary emergency department utilization, supporting law enforcement deflection efforts, reducing jail bookings related to behavioral health, and increasing access to appropriate treatment pathways. This is a community stabilizing strategy, not just a crisis response model. Mobile crisis response represents a shift from reaction to prevention. Instead of arrest, hospitalization, escalation, we provide stabilization, de-escalation, connection to treatment, and hope. As our materials say, hope is here. We appreciate the city's partnership and look forward to continued collaboration and strengthening Casper's behavioral health response system. Thank you.
Any questions for Jason? Yeah, sorry. Didn't see you behind there. Go ahead, Randy. Please, knock yourself out.
Okay, I want to start by saying, I'm not going to ask you to dumb it down. I'm going to say, well, real world, help me how this works. So my first question was going to be, how do we get a hold of you? But I see there's a phone number. So I actually have so many questions. Y'all tell me when you're bored. My first one that I would like you to help me picture. I kind of picture a mobile ambulance that's full of social workers, and that's not really my visualization, but I talked to a kid once who had a really good idea that sounded like that. So 1, how do you do it? And 2, who knows to call this number? And give me like an example of what you're currently doing in your social worker ambulance, which in my brain is what I currently
Yeah,
have. So
we've
you
got a
can probably
great
paint that
outreach
better.
van. We have several vehicles that we use. Some of them are not as exciting as the ambulance. Some of them are just a Toyota Caravan, or what are they? They're little minivans, Siennas. But we do have a mobile outreach van, which is pretty fancy, that we're real proud of. But that's retained mostly for when we provide services in the community, such as telehealth visits or other services from our organization. So basically what's going on is we've got 2 people at the center right now at 1430 Wilton Circle that are on standby. And if you were to call that number right now and say, look, I've got a person that's in a mental health crisis, I don't know what to do, they would get your name, the address, ask some qualifying information, and then within 15 to 20 minutes, they would be knocking at the door. So they would ask that person to come outside and talk to them for a while. We would do a risk assessment. We would determine eligibility for multiple services from Banner to WBI to CSS at CWCC, which is the Crisis Stabilization Services Unit up there on the campus, or perhaps residential drug treatment or outpatient drug treatment. And once those services were determined, they were eligible for these services, we would coordinate the transport to that service. if the scene was safe, if they were not combative, if they weren't violent, if they, and there's a cap on the blood alcohol level that we can transport on. So they've got to be able to function and able to walk on their own. And if they're not, we'll coordinate an non-emergent ambulance or an emergent ambulance if needed to the hospital for stabilization. If that's the case, they get to the hospital, we keep tabs on them, we stay in close contact with the case management team at Banner, and we arrange to go back and get them when they're ready to be discharged and come up for treatment if they desire that. So that's kind of in a nutshell how it all functions on a daily basis, yeah.
What do you think? What do you think of that?
Back up
Sure.
just a little bit, so even more basic. Is it more likely, rather than, would somebody call 911?
That is my next question.
Oh,
Stop.
right.
Okay, go for
I
it.
am taking back the floor.
Pat, let's go ahead and let Brandy have a moment to ask her questions.
So who knows to call this number?
So more and more people are learning about this every day. And
Okay.
as we've seen in our call volume, that's increasing month by month, and we hope that it keeps growing. We'd love to be able to hire some more people to get them in there as the need presents itself. So far, the hospital, a lot of the general public, a lot of our clientele that have completed and then re-entered society, and there's a crisis for them or someone nearby, a family member or a loved one, they know to call. The police department knows to call Chief Cheney. He's asked, we've done ride-alongs with Casper PD, and we're going to be more embedded into the normal operations once we've sat in on a day's worth of dispatch. So he's asked that we participate in the dispatch for a day to see how it all works, and then we kind of figure out how we're going to fit into that dispatch call. And essentially, it would mean the scene has been determined safe by the officer on scene, and that there's a mental health crisis or a substance use issue that we could respond to, and that the officer's discretion could be used to alleviate to divert them from going up to the jail down over to our services.
That was my exact next question. So our goal is, at least maybe positively here, that maybe they can just call 911 and someone there will be like, this might not be, or will the police go and be like, this isn't us? And then you guys come and then that's, because my next question was, who decides it's safe for you and not? And do we have to have two separate numbers, or is it going to ultimately be 911?
It will be both. It will be
Okay.
911 and that number on the page there.
That everyone can.
It'll be with the fire department, it'll be with EMS, and it'll be with the police department. And it would be us, as in all of us. The officer on scene would determine that it's safe to bring us in. They probably would stay until we make a judgment call on whether we can use it, we can take them up to the center, or they could need to go to the hospital, or if they want to take them to jail, ultimately. So we'd have to kind of base it upon the exchange, the interaction with the patient, and the officer's discretion, and the other factors that might play into that decision-making process.
One more and then I'll let you know. So right now, if they call you directly, the police aren't necessarily involved, or do you have an officer that's going with you to make sure it's a?
Right now, we do not. So that phone number is to a crisis line that's, someone will answer that 24 hours a day, 7 days a week, 365 days a year. They're at our center, so that phone number will not summons law enforcement unless we call them to come with us, which
And
isn't
you guys make that judgment call. We feel like we're okay to go check it out or not.
right. And situations have come up like they call us and they say, well, my boyfriend has barricaded himself in the apartment and he's got a knife, and that would be like, okay, well, we're going to call 911, and that needs to be handled by the police department. Or if they just say, we don't know what to do. He's been drinking for 5 days, and we're concerned, and he's stumbling around outside and causing a scene. And then we would go over there and assess the situation, as long as he wasn't violent or hurting anyone or safe enough for us to approach.
Okay, that answers my questions. Go ahead.
All right.
Pat, do you have any
Great.
follow-ups from that or
I
clarification?
know,
Is that good? See what happens when you wait?
Thank you, Mayor.
I love you, Pat.
I'm embarrassed for myself.
It's okay. I
I
was
love you.
really controlling tonight. It's not on you. This was my time. Thank
Other
you.
questions
There are
for
no
Jim,
bad
Jason, or
questions.
John? Yep.
Thanks, Mayor. Thanks, gentlemen, and everyone else that spoke for all the information. So kind of like Councilor Haskins and probably Councilor Sweeney, just still trying to wrap my head around what this looks like in practice. So do you foresee either in the short term or the long term? I'm thinking of like a welfare check. Somebody hasn't shown up for work for a couple of days. We don't have any other context other than they haven't shown up for work and their friends are worried about them. Is that a call that you guys would potentially respond to?
There's-
or-
Possibly, but going to uninvited to a private residence is not something that, unlike law enforcement, that's not something that we're covered to be able to do. So if we don't have contact from that person willing, if somebody at the residence isn't the one calling, there's some challenges there for us to, I think there's evolution here, as Kelly mentioned, alignment within level 2 with our partner agencies to look at what the best solution for some of those things are. The goal obviously is to have law enforcement remain on patrol and have these kinds of incidents be able to be managed by a team. And community paramedicine is a great way to do that and provide that. Then there's the opportunity for triage and medical and those kind of assessments to be handled right then so that we're not unnecessarily calling an ambulance. Our team's not qualified to assess that medically, so we sometimes are using Banner more frequently than maybe is necessary, but we're not qualified to make that call in the field. So.
Thank you. Appreciate it. Sorry, not to spend the whole night with hypotheticals, but again, just trying to understand the process. Let's use a different example. Maybe somebody downtown appears inebriated or under the influence of drugs. Is that something that you guys would be the first touch on? And then if they don't accept treatment or don't want to be work with your mobile team to get access to treatment and stuff, at that point you call the police and it becomes a criminal, like a, just trying to wrap my head around where you guys respond to and under what circumstances you escalated to the police.
In a public space like that, we could respond first and try to engage somebody. I think one of the things of being the community mental health center, our teams already often know a lot of the folks that are going through some of these things. They have chronic conditions that have been treated for years with us and so forth. And so sometimes there's even a rapport that's available for us to access. Yeah, at that point, and then we would want to avoid calling PD if possible. Just looking if there's any, as Jason mentioned, any unsafe behavior or like that. But the goal is to be able to engage people in the community and get them connected to resources and services, whether it's Banner ED or whether it's WBI or our facilities.
Good question. Yeah, Michael, and then I'll get you.
Jim, good to see you. Glad you made it. One of the things that I'm glad you said something about building a rapport with some of them. When I was riding with the response team up in Edmonton, we would stop and several of the unhoused there would recognize the girls that I was riding with and come over and start talking to them and ask questions. So I'm hoping that we will get to that point here where you'll be able to recognize people and know what their situations are. So
Yes.
already seeing some of that.
Yeah, and it's why it's really important that the level 2 response is coordinated with level 1, and so that during the prevention and outreach, they remembered a cup of coffee and a sandwich, that our team was there as well, so that we're not only getting there when it's a crisis, but there's some ability to build relationship and find that over time, folks kind of can come around and being more willing to receive services once they get to know people.
Excellent.
So is there protocol though on, is it Title 72 or Title 27? 25.
Involuntary hospitalization.
Yeah, I mean, are those protocols so that there's some paid on some of this, or is there a different funding model in place? I'm not quite, and I'm thinking in my own mind, the safest bet is for, say a downtown business or somebody still to call 911 and then let, the police department then call in.
That's been our practice over the last year. The police department has wanted them to come and assess a scene first, and then they make a call to us to come out. The ultimate goal would be to have an established team be able to do that in lieu of having law enforcement brought in. But right now, for safety, our partners at the PD have asked that their CIT officers be able to be involved and make sure things are secured. And then with their discretion, they can leave the scene and let us kind of That's been the most common scenario.
To the payment portion, how might that look or work?
There are some minimal payment options through the Department of Health contract that we have. It's not a sustainable model. Currently, we're operating and submitting grants on a year-to-year basis to fund the team. So that's how funding is going. There is, with partner agencies, I mean, right now, currently, the protocols for Title 25 generally don't involve our team. We can't transport once that happens. They're going into custody, so it's got to be an ambulance or law enforcement, and then they go through Banner ED. But this would allow, if people didn't need that kind of service and they weren't at a point of Title 25, that we could alleviate some of that traffic in the ED, possibly, a lot of it's substance use detox, those kind of things. The folks that are going in, the ability to reduce the burden on that team is part of the goal in working together. But from our understanding, the process currently is working pretty smoothly with WBI and Banner Health with Title 25.
Checks or cash would be fine.
Can I ask a real quick question here?
Yeah.
Well, actually, go ahead and, can I jump in, Mike?
Sure.
And I'll
Just
get
very
you-
quickly, so I think what's being discussed here is much broader than Title 25. So there's very specific legal criteria that have to be met due to a mental illness. They have to be either a danger to themselves or others, are unable to care for their basic daily needs with or without assistance. And so if the primary diagnosis is a alcohol dependency or drug use, that doesn't qualify for Title 25. And so my experience in handling these is those often get kicked out of the ED. So really this, I think the interactions that we're talking about and the response is really much broader. Unfortunately, a lot of that doesn't come with a revenue source or a funding source.
Appreciate it.
I did notice
Yeah,
Banner
Lance is
Health
here.
has arrived.
So if I could just ask a real quick question, I'm jumping right in front of Michael and I apologize. So talking about sustainability, you guys were kind of mentioning the financial impact of you guys trying to run this. I guess two questions. One, does this generally come out of the operation budgets of the CWCC for you guys to handle that? You guys have, and maybe I missed it, grants, what financial support do you guys have and what's the sustainability around doing something like that? I think that's important. And I think thirdly, is the trust financially backing this and giving you money for it? And I know that's a couple tough questions. So
The initial would be it's braided funding. So some of it is federal pass-through grants through the Department of Health. Other opportunities are, some of it is general operating funds from CWCC's providing. So for instance, a referral into treatment, goes into general operating, we pull some of that. And then a third part of it is also looking at opportunities for sustainability. Right now, it is year to year and a challenge to go 24/7 for us. Our goal and strategy is to try to partner better, as Kelly mentioned, with partner agencies, including Fire EMS and PD, to be able to co-locate and co-respond. So then the number of team members on our salary schedule can be cut down and partnered up with folks. So then it doesn't necessarily increase the cost at any agency. We're just partnering together better and more fluidly. Nationally, most programs that run really well and sustainably are line item budgets in the county and city, in addition to partnership with healthcare funding and some grants. But without it, it's a very difficult process to sustain.
and to my last point, is the trust supporting you financially?
Well, we do receive a general operating grant from them. Nothing specific to the mobile crisis team, but we did receive their general operating grant. So indirectly, yes, they're very supportive. Specifically to this initiative, we currently don't have any specific grant funding for it.
Okay, that's what thank you so much. I appreciate it. Yep. Michael, sorry about that.
Thank you, Mayor. No, I just wanted to touch for a minute on the youth and juvenile violence as it kind of relates to maybe not necessarily the mobile response team, but I know I think some of the impetus for peace in our cities was kind of came not only from the challenges we face with individuals who are unhoused, but also with a couple of violent issues or events we had in the community in the last 2 or 3 years. that raised some alarm. And when I think of those, I'm sure there's others, but it's not necessarily like gang violence, but it's what I think of is my impression is like conflicts between youth, in other words. And so that's kind of what I'm wondering is does that fit into the picture of, because I know there's like a community-wide violence prevention initiative. I know, and I've had a lot of contact with the Youth Mental Health Collective. And I think that's some good work that the collective is doing, and that through the trust that is, it's reaching into those middle school and high school youth to kind of get their perceptions. And I think in some senses creating some awareness that maybe wasn't there before. Now, whether it's getting all the nooks and crannies and people that it needs to, that's a whole challenge. But I'm just wondering if you have any immediate kind of concrete ideas for how to start. And it's a very ambiguous, very challenging topic. So I'm just wondering if you have some thoughts that direction.
Yeah, and I know Jai also could speak to a lot of this. There is a lot of activity and
I
coordination
meant
going
it for
on.
anybody in the
agencies.
agencies.
Yeah, and I think progress being made because the phenomenon that you're talking about is very different than a specific response to a mental health crisis. It's not symptomatic in the same way. And youth response is very complicated because they can't consent. So we don't go out on youth calls unless we've got to have a consenting adult before we can engage them because we're a mental health provider. So it complicates a bit. We're involved more in our participation in, we have therapist counselors inside the schools and working on some programming and some different things with the collective and other agencies, including Boys and Girls Club. So having on-site counselors there that are more involved in day-to-day. So one of the things we've worked out with Boys and Girls Club is a curriculum for all of their coaches that enhances their ability and awareness for mental health and violence reduction. So they're having those conversations with their coaches and with their counselors at after-school programs. And so if there's a need arising, they're able to make referrals a little bit better. So that's Central Wyoming's place. And then we do have an initiative submitted to a foundation with the Youth Crisis Center to cooperate and create some residential housing, or I should say group home housing with high intensity treatment support for youth at the Youth Crisis Center. We're still waiting. We should hear in April whether or not that initiative goes forward. So there's a lot of efforts a lot more than that are going on in the community, but those are some I could speak to from our agency.
Thanks, Joe.
Yeah, I think the only other thing that I would mention is just part of the reason that we can have this conversation about mobile crisis is because many of the key players and the processes and the strategies were understood and under development, kind of along the same time as we were investigating and learning from Edmonton. And so there's still a lot that we learned in Edmonton, but we're trying to make sure that it's aligned with the work that's ongoing. So, Leanne, at the Trust, the Trust has been a tremendous partner. Obviously, our community is so lucky to have them. They've been leading, and so we're trying to learn through their youth mental health collective as well, and the work that they're doing there. There's also a mapping they're doing this Thursday and Friday, and so we're hoping that what we can do is, learn more about what the core needs are here, and then are there things that we, programs or strategies that Edmonton had that may map on to what we're doing here, but we're just trying to make sure we're doing it mindfully and rather than, having different things pop up. I will say I had a call the other day and there is potentially some interest in trying to pilot with partners here, maybe some interest in looking at the boxing club that was started in Bristol and seeing if there's maybe an opportunity to work with local partners here and do something similar, which is really focused on providing, trauma-informed care and mental health services through activity and action and sport. And so we've got partners through Peace in Our Cities that can connect. But again, we just want to make sure that it's all mindful and coordinated with partners who are already doing that work. And so definitely it is not off the table. It's just that it's at a different level of readiness, I guess, if that makes sense.
Yeah, thank you.
Go ahead, Brandy.
Bring us back to the subject anyways. Let me do this. You started this. Okay, so financially, I'm visualizing here. And grants are great. I feel like you got a little opioid money in there too. So look, we helped. But I feel like if this works, I'm guessing here, so tell me where I'm wrong, but if this starts working and it becomes a functioning part of a lot of our calls, then maybe funding will come from the chief who's not here. He's gonna be so sad. I didn't call him up in person, but maybe some money out of PD, maybe something out of fire because they don't do as many call outs. I'm looking right at you. You stood up, so maybe Banner's gonna participate a little because you're not throwing all the patients directly to the ER. Is that kind of how this works as a group where it's long-term sustainable by everybody that is not paying billions of dollars out of their pockets for these potentially unnecessary calls to support this? Is that the bigger picture, the long-term goal?
Yes, that is. And one of the things we've got with the groups that are working on this is we've all we're all participating in a data collection instrument that'll allow us to run and really have more actual hard numbers around cost deferment and those kind of things, and the numbers of folks deflected and not being moved in through the really, again, kind of clearing out so that Banner's ED is getting clients that really need to be in an ED, and folks that can do lower level treatments and interventions are able to move in and do that. So yeah, that is the goal, or the idea is that if we're all doing better and saving, then we could share the responsibility and serve the community without having to come in with just a hat out, passing it around, asking everybody to find money that we don't have somewhere else. But I am on record not asking for the chief's budget to be reduced. Just want to say it.
So I think you're spot on. It's a group effort, which is why we're all here together. In other communities I've worked in, I was the CEO of a hospital in Arizona, community of 17,000 people. It had a fully functioning 24/7 mobile crisis intervention team. A lot of that was covered by Medicaid expansion. I understand that is a bad word here in the state of Wyoming, but that's where a lot of that funding came from. And so in the current political situation, we have to rely on each other. It has to be an effort. The more we do meeting patients in the crisis means the fewer that are actually put on one of those holds, which means they're not going to go to an inpatient holding or an inpatient behavioral health hospital, which means they're not going to lose their job, which means they're not going to lose their apartment, and continue that downward cycle. If we meet people in the crisis, they don't end up in an ambulance, they don't end up in the hospital. That frees up our beds so we can care for the strokes, heart attacks, the really acute need. And then they can be met in the community, receive outpatient treatment, but it's going to take everybody working on this together. It hits everybody.
Finish.
Yes, you may finish. I skipped over Kyle, so
I'm sorry,
I
Kyle.
felt bad. Go ahead, Brandy.
Okay, so we collect data just on the court level of our diversion stopped this many days in jail. So my thought process is that this is actually going to be reasonably easy data for you to collect. And at the end of the day, say, well, we saved you this, we saved you this, we saved you this. So we should have a pretty good idea of how, as this works and as this grows, who you're helping, how much we're saving, so you can tell all of us, again, tell Lance how much money you saved him. So the Banner is like, yes, we'll throw some money at you. The city can just say, well, we now don't have to pay the jail $1 million. We save this much. So this is like actual data that we can actually collect. We can actually see hard numbers and progress, not just the stories, which of course everybody likes a story, but also you're looking at us in money. So this is, we can see it, we can make a change, and this is something that can happen sooner rather than later, right?
I was
Is there
gonna have
any
our city,
downside?
what's that?
Is there a downside?
So
Tell me,
I'll have our city
Tell me
manager,
the
our city
downside.
attorney answer
Mayor,
some of your
Mayor,
questions.
Council, no, I'm not going to speak about a downside. I don't think there is one. You're all very aware of our diversion program that we have going on in municipal court, and the data that we've collected heretofore shows that we've saved a lot of jail costs. We could probably spend all evening talking about the efforts to stand up core data and the data sharing that's going to be happening. I view tier 1 and tier 2 is really earlier interventions. When you think about the sequential intercept modeling, it's how do we intervene with these folks so that they're not getting arrested, they're not spending nights in jail. And so I absolutely believe that, so Kelly and the PD and the health department start their outreach. That tier one, that's going to be data collection. That's going to be get a baseline, make forge relationships with these folks that are unhoused or in crisis. That will set up the level 2 response that Jim is talking about, and will really grease the skids for that. And the more that we can divert out of the ED, out of the jail, it's going to have a ripple effect in terms of cost savings for the city at Fire EMS, at the PD, our court staff, my staff time, jail costs. And I think that we're working collaboratively to put together a data collection system, if you will, where all of the stakeholders can share that data, and it should be, I don't want to say nothing's easy, but it's doable to come back and report and say, yep, here's the impact we've had, and then turn that into dollars saved. And so I always like to say a little bit of investment on the front end is going to save us money on the back end, and I think we'll see that with this program.
Thanks, Mayor. I think I'm honestly satisfied. That was kind of the track I wanted to go down. I know Banner historically, I don't know what the past couple of years numbers look like, but I know you guys have, I mean, the number I was familiar with was like 50 million in uncompensated. I'm hoping we can quantify these, cost savings, because it'd be great if Banner could spend 2 to save 5, and we could, we got a $2 million incarceration budget. If we're able to divert 25% of those people, because public intox is a huge component of that, we're able to take those cost savings and, direct some funding that way. So it sounds like the data collection is a high priority, and I'll be looking forward to reviewing it in like a year's time to see what kind of impact.
Yeah, absolutely.
So as we talk about what are those expense savings opportunities as well is in a lot of communities where you have Title 25 patients in a hospital, the hospital would turn around and build a county for those patients. Part of our post-closing agreement with the hospital was that we would not charge the county for the first 10 years of ownership of the hospital. And so we've been bearing that burden, and we'll continue to bear it for the first 10 years. At the end of that point, though, we would build a county for Title 25. So that's not a city issue, that's kind of a county issue, but we're all residents of the city as well as the county, and should have an impact on that. But the better the work we can do on the front end here, the less then we would then be billing the county, because we're taking care of these folks on the front end, and not when they hit a much more expensive site of care like the hospital, where we're not a behavioral hospital anyways. So.
Michael, and then I'll, do you have a follow-up?
I was just gonna ask Lance if he knew when the end of that 10 years was, because I wasn't aware of that being a component of the sales.
Yeah, so we are in year 6 right now.
Thank you.
Acquisition is in 2020.
Just to put a finer point on that, after the 10 years, Banner pays the 5-year rolling average prior to the closing of the transaction, and anything above that gets billed to the county. They can ask for a cost share from the trust, and then it's modified every year by the CPI index. So I have read it a few times.
Good to
Just a
know.
little bit, right? I didn't want to bother everybody with that detail.
I got to show them.
That's why
Michael, and then I'll get you Pat.
for Jim and Jason on your MCR teams, have you yet, or do you plan in the future to have volunteers that ride along with your mental health people, so that you've got one mental health and one volunteer for that?
We have not pursued that concept. We certainly could do that, as well as a student program that would really, student internships that would be involved would be something that we could enhance. But we haven't got an active plan of that. I think that's an enhancement from Peace in Our Cities, your trip, that is a good thing to pursue, to look at. There are more restrictions in the U.S. around your malpractice insurance than there is in Canada when you use volunteers. So it's not a one-for-one. I mean, they have a very different healthcare system across the board, and so there's some liability that we would have to really investigate about before using volunteers to go in. But certainly something we can look.
However, in level 1, it is appropriate.
Kelly, will you come up? Because we have a microphone.
Sure.
Thank you.
So in level 1, that is appropriate and actually encouraged, because you have, the more diversity you have in responses in level 1, the more different areas you can cover and have better engagement. And volunteers typically are more successful in outreach efforts at that level. So we would definitely, kind of like the system you have people in the Food Pantry Network and others that do a lot of great work and actually relational work that let us know about bigger problems. Same concept.
Reason I asked, the unit that I rode with up there in Canada, one of the young ladies had been doing that for a while, which encouraged her to go into EMT training.
Yeah.
And the other gal was thinking about doing the same thing. And I talked to a couple of the others, and this had kind of swayed them towards getting into mental health and other careers. So
It's how they train pre-healthcare workers in Boston, actually.
oh, cool.
They have mobile units that go out and do medical and homeless outreach, and that's how they train their different levels of medical personnel.
Nice. Thank you.
So more so to Lance, but I was wondering, I was aware of the 10-year agreement. However, I didn't think about it in general, about Title 25 in particular. I thought it was the jail itself, but Title 25 really opens a lot of.
And Title 25 is a larger population than what we see with prisoner care.
So on the payment portion, is the rural transformation, any of that 205 million this first year, any of that laid out for, I think, rural hospitals, which I don't know if we're qualified as a rural hospital. And does any of that lean into this kind of program possibly?
So that's a question we'd all like answered. Matter of fact, Wyoming Hospital Association has a meeting with Stefan Johansson here this week to kind of get more information on what's going to be allowed, what the application process is going to look like. We do know that they want to focus on OB access, behavioral health, EMS access and training, those kind of things, workforce development, but there's very little yet on details about what kind of projects they'll accept and what that application is going to be like. But certainly there's enough coalition of the willing to actually have a really good submission. We just don't know what we'll be able to apply for and what we can't. We're hoping to find that out very soon.
And from the CARES Act, it seems to me that Banner had put in for Title 25 and basically several rooms to be converted. Did that ever happen?
Yes. Matter of fact, those rooms are under construction now. Again, as we talk about behavioral health patients without medical necessity in our hospital because they can't get out. We were waiting for beds at WBI. We're waiting for beds at the state. We have to have a safe place to hold those, initiate maybe some treatment. And so we got a $3 million SLIB fund grant from the state. Those 7 beds or observation beds are going to be built by the end of the year. That will give us some capacity, hold patients in a more safe, secure location. But again, the best thing is to get them to services before they end up in the back of a squad car in the hospital in the ED. Okay. And on a Title 25 hold.
Then lastly, it didn't make it into the bill, unfortunately, but was bear care, which might have helped with a crisis to be able to apply for that bear care, bear essential.
Bear essential, in case of traumatic situation, could have.
Had you heard anything different? I don't know if that's a possibility also.
I don't know enough to know whether or not behavioral health was included in that bill or not. I can reach out to my lobbyist to see if it was or not, but like you said, it wasn't successful, so.
Yeah.
So I know we only allotted a little over time, and I definitely think we could talk about this all night for sure. But I think everybody hopefully got all their questions answered as we go. Thank you guys for presenting and giving us feedback and giving us the numbers. This is, as a mental health therapist, this is incredibly important aspect as we deal with this and try to navigate definitely the issues. I'll just only highlight that in Rock Springs, there was a young lady that just came out committed suicide. The family is very open about that. She had just graduated from the high school up there. So we still continue to to have mental health crisis, I believe, not only in our young people, but in the adults in our communities. And so this is something that I think we need to continue to all work on just as basic human beings. So our continued partnership.
One more thing. I'll regret it, I guess. You had mentioned some ideas on how to help our adolescent population, especially transitional age youth or teens that have been violent. I think there's an opportunity here if we could realize to provide clinical services in the detention centers. That wouldn't be the first line of defense. It wouldn't be the first line of intervention, but it would open up the world of opportunity for those that were unsuccessful in the IOP program or at Mercer. When they return to incarceration or go in on a sanction, we could then provide clinical care while they're in custody and then transition out into a more community-based program after that. The big ticket item is that adolescent residential treatment center, right? That's a big ticket. And we're already housing teens up at the detention center. We're feeding them, we're clothing them. It makes sense to plug in some social services up there so they can get some help while they're in custody.
Thanks, Chief.
My 2 cents. Thanks.
I was going to say, I think the one it's even more ubiquitous though is the who are not in the system anywhere. And then, but that's a very of a crystal ball, to know. But so I think that's where some of that prevention work of the coalition is, hopefully do well.
Yeah.
Thank you.
Thanks. Thank you, everyone. Appreciate your time. Thank you for coming. Appreciate it. Great discussion, everyone. Thank you. Okay, moving right along in our agenda. All right. Let's go ahead and go to our grant coming up. I'm going to hand that off to you.
Mayor, I believe Director Lopez will talk you through or invite her staff to talk you through a couple of topics. The first of which is the partnership opportunity grant through Lark Environmental, and then we'll step into urban forestry. So let's start with the climate smart community first.
Perfect. Good evening, Mayor, councilors. Thanks for having me tonight. Unfortunately for you, it is me the rest of the evening.
We wouldn't want it any other way. That's right.
So we'll start out, yes, talking about the Climate Smart Community Initiative grant collaboration opportunity that we have with Lark Environmental. So Lark came to us. In fact, they have worked with community development, Liz and Craig in particular, in the past and reached out to them and said, we have an opportunity that we would like to approach the city of Casper about, and that is to apply for a Climate Smart Communities Initiative grant, which offers funds to projects that advance community-based climate resilience. The folks from Lark are from Casper, so they really wanted to work on a project in Casper and decided to invite the city of Casper to partner with them on that project. So a group of us from the city staff came together, met with Lark, and talked through several potential opportunities and projects that we could think about. There were some around stormwater, there were some around parks. There were a lot of conversations about possibilities, but ultimately what we landed on as what we feel is the best and most appropriate and most compelling, hopefully, application for this program is a wildfire resilience and response readiness plan for city-owned property up on Casper Mountain, which of course includes Hogadon Basin and a lot of the surrounding property that's operated by the county at this time, but owned by the city of Casper. To the best of my knowledge, unfortunately, we don't have a really robust or any at all wildfire mitigation strategy. We don't have a good forest management plan, at least not one that's updated, and we haven't done intentional work to manage the forest up there to help mitigate wildfire. And so given the winter that we've had and the conditions that we're likely up against, this has been top of mind for me. And so in discussing it with this group, we all agreed that this would be a really good time, maybe a little late actually, but a great time, but better now than never, to start working on a program like this. And so how the program works, Lark, as the design team or the consultant, would actually apply for the grant through the program. It requires the city of Casper to provide a letter of support that we want to partner and that will be a benefactor of the funding that if it is received. It's also required that there is a community-based organization involved, and that could be any non-governmental community-serving organization that would have a vested interest in the project. We reached out to a few, and ultimately, we believe that Central Wyoming Trails Alliance, which is an organized nonprofit here in the community, because of their work in cross-jurisdictional projects, would be a great community-based organization to collaborate with us on this project, and they have agreed to do so. And you might know that their executive director is actually has experience in volunteer and career firefighting, so his knowledge will be pretty important. So again, Lark would apply for the grant. If the grant was awarded, they would be the recipients of the funds, and they would use those funds to draft the plan for us. At the completion of the plan, the city would own the plan and the intention. And I believe that the resilience plan narrative was included in your packet. And so, you know, the narrative that we've already kind of drafted that lay out some of the key objectives, I think summarizes it really well. Our expected outcomes would be a clear set of wildfire mitigation priorities for Casper Mountain. So what I said is I really need something tangible that I can say, we need to do this first, and then the work can commence, right, to start making an immediate impact. Defined options for improving wildfire response water availability. So where is there water available on Casper Mountain for us to access for wildfire fighting? Are the resources that are up there adequate right now? My guess is no. And so identifying other sources of potential water for firefighting would be important. And then coordinating a strategy. So Natrona County is currently advertising to do some work in this space for county-wide strategies. And so we certainly don't want to duplicate what they're doing, but we want to make sure that what we're doing complements what they're doing and really addresses the needs on city property where we would be the responsible agency to execute. And then we want a realistic phased funding roadmap to support implementation. So as part of the deliverable, they will identify potential funding sources that we could then, once we have our program in place, try to tap into in terms of funding to, you know, maybe dig more wells or create a pond or remove some trees and things like that. And then finally, you know, we really believe that this will improve our readiness to pursue future wildfire mitigation funding and capital investments and actually get some important work going to help us in fighting wildfire on the mountain in the future. So with that, I would stand for any questions that you might have. And ultimately what we're asking for is council support to let Lark apply for this grant and give permission to either the mayor or the city manager to sign our letter of support that is required as part of their application.
Any questions about the application, about the grant? Yeah.
So you mentioned the county. Would we include them as part of this or just work in coordination?
So, Mayor, Councilor, they are working on the Natrona County Community Action Plan. And again, I think their RFP is out right now. And so certainly it is the intention that Lark would work closely with the county to make sure that what we're proposing aligns with what their vision is for their plan. And likely they would be happening simultaneously. So it would be a great opportunity for us to collaborate.
Other questions? How does council feel about, we were about ready to say something, Pat? Yeah, go ahead.
So I'm fascinated with the water capabilities, you know, for firefighting in particular up there. And I don't think there is any, but for much, but because I think they've got to fly out to find a bigger body. So I think that would really be terrific. And to that end, you mentioned Elgadon Basin. Do we have a decent supply of water just for the building itself? and I don't know if there's fire suppression in that building.
Mayor, Counselor, we do. There is a water system that we utilize for snowmaking, and we do have a water storage pond that can double as firefighting
Okay.
water in the summertime for sure. And so, I feel like, is it adequate? Probably not. Maybe to protect Hogadon proper property to some degree, but certainly not our neighbors. So exploring additional sources of water, I think, are going to be really important.
Jenna.
So I'm wondering if where the seat base at the airport comes into play with any of this during the research that you're doing. Having that right here is a big.
Mayor, Counselor, that's an excellent point, and I am sure that Lark will collaborate with the airport as they're working on their plan. And I think we have the benefit that they're local, and so they're familiar with what we have going on in our community, and they have contacts in the community already. So I think they're going to be a little better equipped than maybe a consultant from out of town to help us navigate this.
So is council good with staff moving forward with this? Perfect. Yeah. Thanks, Zulema. Who's next?
May I just stay? Ready, Mayor?
Absolutely.
The next item that I wanted to visit with you all about is permission to submit yet another grant opportunity for the city of Casper. This one related to our urban forestry program. So of course, you know that in April of 2024, we were approved with a $699,900, so just shy of $700,000 grant. It was a pass-through grant from the National Park Service through the Arbor Day Foundation for our Branch Across Casper program. That's what we called it. And we were very, very excited. And less than a year into some of our implementation efforts, unfortunately, in February of last year, we were notified by the Arbor Day Foundation that the United States Department of Agriculture Forest Service had issued a termination notice for that grant. So essentially, we lost the funding through the administration's DOGE efforts. And so since that time, we have been looking for alternatives to help us. We know that, through a couple of recent catastrophic storms and weather events in the community, we've lost a number of our trees, and our urban forest is unfortunately reducing instead of increasing. And we also know that through a comprehensive condition assessment that we had of our urban forest last year, we have a number of trees in the community that are considered high risk or dangerous. And so we know that there's significant need, and we need to start addressing these things as quickly and as efficiently as possible. And so we were really excited when the Wyoming State Forestry Service Urban and Community Forestry Program came to us and said, we would like to have the city apply for a grant opportunity, a little bit bigger grant than most of their other programs allow for. But I believe the intent was to target some of the Wyoming communities that lost funding that they would have otherwise had through the Arbor Day Foundation or the National Park Service. And so we have the opportunity to apply for $100,000 with the emphasis of removing high-risk trees to protect public safety and property, and then plant and maintain the new trees that are planted in their place to enhance our canopy coverage, increase our species diversity, and improve the overall health of our urban forest. As you all know, park resources have dwindled a little bit over the last couple of years. And so as such, we do anticipate that we will outsource all of the work associated with this grant. And so we estimate that $100,000 will pay for approximately 25 to 40 removals of high-risk trees in our boulevard tree areas, and then replace those trees with new plantings. So that is our request.
Questions about this grant? Is council okay with staff moving forward with this? Bigger. Yeah, right, yeah.
Yeah, 7 times bigger.
Right.
Mayor, if I
Yeah,
could.
you bet.
So last night, during the Amber and Kyle show,
Yes.
but I mentioned about the Arbor Day and we're talking about grant funding, and I didn't see you in the back row until after, but I apologize for not recognizing all of the hard work that your crew has put into all of this, plus all the grants that your crew is able to. So I did shout out to Jolene about the river restoration.
Deservingly so.
So
There's other opportunities. Good thing there's social media, Pat.
That's right.
what social?
We're gonna set you up a Facebook page. Pat.
Counselor, I would say that
TikTok.
Alec is in the room, so you could easily. She has worked very hard. The Branch Across Casper program is spectacular, and we plan to implement it. It'll just be a little slower than.
Thanks, Susan. Appreciate it. I think we got one more item from you, right?
Oil City Games.
Last but not least, Mayor, councilors, it is probably my least favorite time when I come to council and talk about rate increases at some of our rec enterprises. And tonight, the opportunity is to talk about golf. And so we are requesting council support on increasing our rates at golf and consideration of the implementation, of a new facility fee at the municipal golf course, effective immediately so that it can impact our 2026 season, which given the weather may actually start a little sooner than. So, of course, you know about the Golf Enterprise Fund. We are proud to say that it is the only enterprise, the recreation enterprise, that is able to sustain its own operating expenses year over year for quite a long time now. So our cost recovery goal is set at 110%. We frequently meet or exceed that cost recovery goal with a primary objective over the last couple of years of getting to the point where the fund, the golf course fund, can not only sustain its operating expenses, but also take care of the majority of its smaller capital needs in terms of mowing equipment, other bunker materials, the things that we need, cart path improvements, sort of year over year in capital to just improve the course or enhance the user experience at the golf course. And so we've really worked hard to build up the fund in a way that we don't have to rely on other city funds for much other than, really large capital expenditures, i.e. clubhouse, which I will talk about a little bit later. But we are proud that over the last couple of years, again, we have been able to cover our operating costs, retain $290,000 in operating reserves, which is a policy requirement for us to maintain 3 months worth of operating expense. In addition to that, the fund has paid over $400,000 in capital equipment or course improvements over that time, and anticipate an $188,000 investment in the upcoming fiscal year. Moreover, we're putting about $50,000 a year aside specifically for the replacement of our car fleet. So you may recall several years ago, council graciously granted us $400,000 in opportunity funds to buy a new fleet of golf carts. And at that time, we decided that we would start putting money away each year so that when we needed to replace that fleet, we would be able to cover that expense on our own. Trade-in value plus cash equals a brand new fleet of 70 carts, and we are well on our way to achieving that goal with the funds that have been called out to date. So while rate increases are never fun, they are necessary for us to continue operating. And of course, as always, we've gone through a fairly exhaustive exercise of checking comparable local and regional courses to make sure that our rates remain at or below competition in the area, so that our users, both residents of the community that frequent the golf course and people who may be just passing through, are seeing value when they come to the course to play. So one thing, and I do apologize, this was an oversight in the memo, that we are introducing this year is dynamic pricing, which means we are proposing higher rates on the weekends than we do during the weekdays. And of course, that's to bolster rounds during our slower weekdays. But maybe more importantly, it's to try to control the number of rounds that are played on the weekends because capacity is getting pretty challenging with over 350 rounds in a weekend day. That's busy. We are very, very busy as a community. Glad to be, but we do need to implement some strategies, I think, to sort of try to level out those weekend peaks a little bit. So again, we've gone through the exercise trying to make sure that our rates are appropriate, and there are a few other enhancements or value adds that I want to just point out. So this year we are proposing a new senior pass for pass holders that are 70 and older at a $50 off rate. I can say there's only one other course in Wyoming that even offers a senior pass, and that's in Cheyenne. But we have gotten feedback from some of our users that they would like to see that. And so we have proposed to that this year, which is an 8% discount at $50 off their pass. Continued affordability for young players. Obviously, young players are the future of the sustainability of our golf course. And so we want to make sure that youth have the opportunity to come learn and develop a passion for the sport. And so we have not actually increased our youth and child season pass rates since at least 2016. And we'll continue to keep them very affordable, again, to keep hopefully building that future client base. Similarly, pass holders may bring one child 12 and under with them after 3 p.m. To the golf course and pay no green fee for that child. So allowing families to recreate together while also hopefully inspiring some passion for golf in youth is accomplished through that. We do have discounted walking, or what we call twilight rounds, where people can come later into the evening, not guaranteed necessarily to be able to play a full 9 or an 18. No cart, they're walking, but they get a discounted rate to play. I actually play a lot that way. We do have on our existing fleet of carts, GPS and pin detection distance technology devices. So that is an enhancement over the last couple of years that our players have seemed to really enjoy. We do also have a self-service range ball dispenser on the driving range, so people can go right up to the driving range, pay by card, and get the balls that they want to play or practice on the driving range. And that expands the availability of the driving range during our early morning and evening hours. It is our intention to have the maintenance staff open the ball dispenser pretty much as soon as they get on site in the morning, and then it'll be the last thing that'll close in the evening. So historically, people have had to wait until the pro shop is open and then not have access after the pro shop is closed either. And so that is a nice expansion of availability. And then finally, our season pass holders do enjoy an end of the year appreciation tournament with free entry, free cart, and prizes. And that's been really well attended over the last several years. So I'm going to stop there and see if you have any questions related to just our fees before I dive into the facility fee discussion.
Any questions about the recommended rate increases? Yeah, Brandy.
I don't actually have a question. I have zero knowledge. Spoiler alert, it's not good for you. So I don't do it. I just looked at the numbers in the comparison. The only thing I saw that didn't look super cheap compared to everything else was golf carts, and ours are way cooler, understanding, right?
Mayor,
Just say
Counselor.
yes.
I mean, to be fair, it is fairly industry standard anymore to have GPS capability on your golf
But they're
carts.
good.
They are good.
So it's way cheaper. Like, I don't golf. I just looked at the numbers and it's way cheaper. So, good job.
Amber.
Like to let council know as well that Zalim took this to the Parks and Recs Advisory Board, and as another way for that board to engage and help guide the decision making around this. And I thought that was great additional information. They did support it and provided some additional feedback on it, and so there's just a second level of vetting that will be coming our way from that group. And so I appreciated their input, and it did seem like many of them either were users themselves or have networks of folks who are users, and so they did make use of those folks, asking them what they felt about this. So wanted to let you all know that. I certainly appreciated the input from folks who are using that facility. And then wanted to also note that we did hear from golf on our October Parks and Rec meeting. And just to give a little bit more detail, the vending machine that was installed, they indicated that increased driving rate sales by 55%. Season pass sales were up 21%. And I asked why. The folks there said they felt like the value proposition has just driven that increase, and people are really enjoying the improvements that were made to the course. And I heard from every group that they wanted to see that investment continue. And so I think, for those reasons, the folks who are using it really think it's a great course and want to see us continue to invest in it. So I think that for the most part, people indicated that they would be happy to support that through their fees. So
Thank you.
So, I know we haven't had snow, but I mean, people are miffed about season pass and not really a lot of value, and they understand there's no snow and all of that. And I did wonder if the same thing, I mean, are we gonna have water enough this summer? I'm hopeful we will have a wet spring. But I'm wondering about that. I also kind of wondered if anybody saw this letter to in Oil City on ideas of reciprocal wild pass, Indy pass on ski slope. If there's anything similar, I don't know what I'm talking about on that stuff. But is there any reciprocal agreements with our? It used to be with a season pass at Hogadon, you could get a discount at Snow King, but not out at Teton.
The one in Lander.
We have several partnerships, excuse me,
Oh,
Mayor
okay.
Council. We do have several partnerships still for discounted days, passes. I mean, it varies depending on the resort that we're partnering with. But we do still offer, I think it's at least 5, there may even be more than that. I can't speak to Snow King specifically, I don't think so anymore, but our pass at Hogadon through that does offer great value because of the discounts that you can get at other ski areas. I'm gonna have to phone a friend and ask our resident golf expert, Randy Norvell, to come up and speak to whether or not there is a similar program in golf. Not to the best of my knowledge, is there any kind of reciprocal agreement with other courses? However, I can say that I have encouraged our pro to at least have conversations with Three Crowns and see if there's opportunity there. There's the 2 public courses in town to partner on opportunities. I don't know if those conversations have gained much traction given the change in leadership at Three Crowns, but
Hey, Randy?
Evening, Mayor, Council. Generally, there are no reciprocal with other courses on that. Sometime in the private industry, they do reciprocating events with other courses, but for municipalities, I've never heard of anything like that. I'm not saying it's not possible in the future that we could strike deals with other courses.
I'm guessing like Three Crowns in the country club, maybe Paradise Valley have agreements with maybe other, like Casper Country Club might have other private clubs.
There has been stuff there in the past at the country club, but there's nothing going on right currently. And generally, both the private clubs in town will work with each other during tournament events to sit there and help their memberships. But other than that, there's
Not a lot. So I didn't know if there was potential for the municipal golf course if a value added type thing. Yeah, I am reluctant. Don't disagree with the facility fee, but you know, but I'm a little worried at pushing rates too much. Some of these are not very much, but I'm concerned about that. And then the last one on, so like your senior season pass, is that any day of the week or are there some restrictions? Because I think there's one pass that they sell over at Three Crowns. Is it Mondays?
Mayor, counselors, so there it wouldn't be no restrictions. We had this conversation. We don't want the front desk attendants to have to ask people for their IDs when we're busy, right? So if you have a senior pass, you can come any day and golf. Three Crowns, as I understand from Randy, does have a Monday senior rate, but we felt like it would be better value. Just discount a pass and they could come any day.
Most of the seniors won't golf on the weekend. They don't like all the crowds, so.
Okay. On to the facility.
So thank you, Counselor, for segueing a little bit into the facility fee. And I appreciate Counselor Pollack mentioning the Parks and Rec Advisory Board, because when we proposed this to the board, one of the comments that we got back is that it felt like having the rate increase on top of a 10% facility fee, which is initially what we proposed, felt like a little bit too much. And so after numerous conversations, we decided to scale that back. So the proposal right now is that we would implement a 5% facility fee this year in conjunction with our rate increase. And then next year, also implement another additional 5%. That again would be just the facility fee. So all the pass and ticket or day pass and cart rental fees and all of that go to our operating expenses, right? But the facility fee would be called off specifically for a clubhouse fund. That is our proposal to this body. And so after the 2 years, it would be a 10% fee and then would stay at 10% arguably until we raised an adequate amount of money to be able to contribute to the construction of a new clubhouse, which we're estimating is $77,000 this year at 5%, essentially double of that next year. And over time, as inflation and costs go up, we hope that that facility fee could earn in excess of $2 million in about a 10-year period. Again, that could be contributed to the construction of a new clubhouse. Certainly that would not pay for all of a new clubhouse, but would be a start in the users really helping to make that investment in the facility. And so 5% this year, 5% next year, again, vetted through the Parks and Rec Advisory Board, and they felt like 10% upfront was maybe a little too much, but supported the fee overall for yet another building that was constructed in 1980 and is looking to need some replacement improvements for sure, which we've continued to do, but eventual replacement given a structural analysis that was done by Bob Lower here in town, where he said, really given the condition and some of the things that are happening to the structure, it would be comparable price to just build new.
Questions about the facility fee? Yep, Michael.
It's kind of both facility fee and I guess questions as much as comment, but so I'm not a golfer myself. I'm not avid. I mean, might do one game a year if I have a cart. But anyway, I have had several buddies friends who golf that have reached out to me over several months. But anyway, their feedback about it and about they're very complimentary about Jason and Ben. Do a great job, and the grounds and the courses, are kept very nicely, kept kept in shape. They, with the fees, I think both the increase and the facility fee, I think what they were kind of encouraging was to, so for example, if there is some, renovation or, improvement done to the clubhouse using those fees, that be kind of communicated with some signage or something, just to kind of say, here's where your money's going, that fee. That was just a suggestion there. But I think that they had there were some other, concerns that they had. I mean, they feel, like I said, the grounds and the landscaping are looking good. But I think I think they would like to see, they generally, I would say it was like in the realm of like customer service type things. Sometimes, feel like the management is good, but that sometimes it felt like the customer service could be better. And I'll write these up and send those on so you can consider those. But anyway, that was their feedback.
Mayor, Counselor, thank you for that feedback. We appreciate getting that, and certainly we hear some of those comments as well, and are working with staff on some solutions to help improve customer service. Like most of our seasonal operations, we hire employees just for the season, and sometimes it's hard to get a stellar crop of all wonderful seasonal employees, although we strive for that. And golf is quite popular, so they generally do better than some of their other operations. But we are looking at strategically placing some adults or more tenured golf course seasonal staff that have returned year after year in roles where they're acting as leaders for other newer employees that can provide some extra guidance when the pro or assistant pro aren't there or readily available. And so we're looking at ways to improve leadership so that we can really focus on customer service. So yes, please give me your feedback and we'll continue to work on that.
Just a general comment. I think that the facility fee model to me feels like the most viable path to create some amount of sustainability in these buildings when we're looking at so many of our facilities needing to be replaced sort of all at once. And likely 50 years from now, they'll have that same problem because we built a lot at one time and we're renovating a lot at one time because they're needing it at a similar time. And I just think that unlikely that will cover the entire cost of a new capital build, but certainly having a designated funding source for some of those things feels like we're being better stewards of those facilities personally. So I support that direction. I do feel a little more comfortable with the phased approach just for the sheer like 1 year sticker shock that was sort of there. And so I think there's some wisdom in that. But overall, I think that the direction is good for thinking about facilities where we can for stewardship.
Yeah, Amber, you took the words right out of my mouth. I think it's
That was my
prudent.
plan.
Was it?
Yeah, that was my intention. Yeah.
So you wouldn't talk.
Yeah.
Trying to get
But yeah, I mean, I absolutely agree. I'm comfortable, number one, because it was vetted by the rec board, rec committee, and so that's good. I think it is being mindful and being conscious of the fact, how do we continue to raise rates are inevitable, but how do we do that pragmatically without doing it in 5 years and being like, oh my gosh, we have to raise it by 30% or something. I think that that's smart and doable. So I'm 100% behind all of it.
Thanks so much, Randy, for all the information. I'm stoked to hear we're already socking away money for fleet replacement. Very glad to hear that. We haven't talked about dredging the pond yet, and I know that was an expensive one, so I imagine that'll be a future talk item. I was curious this because we had a super warm winter, did we extend the season at the golf course? Like, what ability do we have to be flexible over the winter when we have a really terrible winter, at least from a Kogadon and weather perspective? Did we give people the ability to use the course or?
So we put out temporary, I'm sorry, Mayor, Council. We do put out just a temporary green where they can go out year round. We don't charge it. It's just all free, just people out exercising. it's hard to get your swing in shape when you're wearing Carhartts and gum boots or something like that to go out there. So as long as they stay off the tees and we keep them off the greens because we do tarp those greens for the winter. Generally November 1st through April 1st. So
You can go out there now?
you can go out anytime you want. We've been
Really?
very busy.
Oh, geez.
In the afternoons, they just go up, park, and then head out and go walking.
I'm late to the party on that.
We don't
one,
charge this time of year, especially with the grass so dry right now. I don't want to see cart traffic out on it.
Okay.
But
Awesome. Good to know.
that's any year. That's what we do.
So when we think about our cost recovery goal, does this new model change that at all, or does it sort of just live in its own separate thing that's imagined to be unrelated to operations? And if so, how do we think of that 10% over and above operations, and how do we conceptualize of that and think of it when we see our chart?
Mayor, Counselor, good question. And the honest answer is I haven't quite figured that out.
Great.
So
I'll give you time, but I just was like, how does
Requested
it-
council, we are starting to work on all of our business plans for all the rec enterprises, and we'll be vetting those business plans through the Park and Rec Advisory Board and then bringing those business plans to council. And part of that discussion will be evaluation and maybe adjustment, if it's appropriate, of our cost recovery goals in each of the enterprises. And so your question is important and relevant. We'll be evaluating, because if we're gonna direct certain amount of those operational dollars to capital, i.e. carts and now this facility fee, we want to probably keep that separate from the cost recovery goal that is generally really focused on an operating subsidy or recovery. And so I think we will have to figure out a way to mathematically calculate that out and then establish or retain a goal from an operations standpoint that makes sense.
Thanks.
Good questions. So is council supportive of the facility fee and then the rate, the hike rates of the rate? Okay. Whatever it is.
Maybe don't use that.
Maybe don't use that one.
Thank you.
Thanks,
The
Elaine.
rate increases.
Adjustments appropriate.
Oh, appropriate
rate
adjustments.
adjustments.
All righty, let's go ahead and go over agenda review. I know we did a little bit. Janine kind of hit some points earlier in the meeting, but does anybody have any conversation around upcoming meetings, anything like that? Okay, let's go ahead and do council around the table. I'll start with you, Michael. Sorry,
Me, Michael?
McIntosh.
Sorry. All right. We had MPO meeting this past week. They forgot to advertise that we're gonna elect new chair and vice chair that we don't have now because they both went away.
Both of us, huh?
So we're gonna be doing that next meeting. Yeah, both of you just kind of. We're excited to get the walking counters that we approved last week so that we can save a lot of money on those different grants that require us to do some counting. And yeah, that's about it. That's the only excitement I had last week.
Awesome.
In the realm of the city.
Thank you. Brandy.
I hijacked.
Yes, you did.
I know, right? But
Almost as
I
bad
am
as Pat.
returning it now. Just took it early.
I like
Learn
that
from me,
strategy.
Pat, learn.
Matt, do you have anything?
I don't have anything rather, I attended the Lyric Invitational thing just to get their update and enjoyed that very much and hearing more about that.
Missed it when it's your turn.
I don't
That's
know
all
what
I
we're
had.
talking about, but I'll just shake my head, yes, I'll get
We
to it.
lost the sound at the last work session, so I need you to replug the lyric.
Oh, gotcha. Okay. Mr. Sweeney. Wow. She did mention that to me last week.
I am trying to not talk. I'm trying.
So, thank you,
Can I
Mayor.
say one thing?
Oh,
Sorry.
absolutely.
I did mean to say this too. I I just wanted to take a minute to honor Ann Tollefson, who was an educator here in Casper for many years and just was a remarkable teacher and leader and incredible person. So just if you knew Ann, you know what I'm talking about. So we appreciate her time on this earth and just want to reach out and tell her, let her family know we're with them and thinking about them. So.
I think it was last Wednesday night, Platte River Trails had kind of a, I don't know, was it an open house? And Salima and I have seen a lot of each other.
We're sorry, Zelina.
Yeah, she is too. But a lot of information, and I thought it was really very good. And I did, and one, I think it would be helpful if they are more involved with Three Crowns and Amico reuse, I think, in trying to figure out some of the planning over there. They have had a meeting, I guess, with Rob and Jim, but appreciated that. Then Thursday, I attended my first MPO meeting, just trying to figure that all out. And then later that afternoon, went to the Chamber of Commerce Business after hours over at the Best Western. And then Friday was the LGBTQ. I'm the alternate.
Nice caveats that.
It does, doesn't it?
I sat outside.
There's some sort of hierarchy. Yeah, we didn't let him in. That's.
Don't blame you.
In case everyone went to the restroom or something. You were tagged.
Scratching at the door.
Yeah. And then Monday, I went to the Casper City Council of People with Disabilities. Again, thanks to Salima for keeping my temper in check. But it was a very interesting meeting. So, some different thought processes that I'm not quite used to. So, and then last night I got there late, but excellent presentation by Amber and Kyle, and hopefully my interruptions aren't too overboard, but it was a real friendly crowd. I don't think people really were there. I appreciated staff, amount of staff that came out to be supportive and answer any. Jill was there, Janine was there, Salima, Jolene, I don't know who else was. So it was good to have some of those folks there in case somebody like me had some stupid questions. So, but I thought it was really good, and I thought the turnout was pretty good. So, and I think had anything this morning except problems. So appreciate those that reached out on the stormwater. More to come, and at some point we will probably need to talk about strategy for the future. So.
I can provide an update on the LGBTQ advisory meeting, though you did just hear from that group very recently. We did recap that presentation for members of the committee that were not in attendance, contemplated to some extent how that committee might want to participate in Casper Pride this year. They've done a data collection booth at some prides and recently have pivoted to supporting the Sunday, which is where the march happens and that sort of thing. So it's up in the air, but it just kind of started those preliminary discussions. We discussed the Casper Cares initiative, with which you saw an example of on the board when they came. This next topic will be the MEI and what is it. We had some comment section dialogue about, well, I don't buy it, a 92, I don't buy it because, X, Y, or Z happens to me out in the community. And so I think giving some context for this is not a measure of the friendliness of the random folks strolling the street in Casper. This is a measure of our policy. And so just trying to provide some information to the community about what this score does capture and does not capture. And, to the point of the people in the comments, it's limited in its ability to assess the overall LGBTQ friendliness of the community, but it does assess our policy. And so providing some information about how that score is captured and gathered in the organization that does it and that sort of thing will be the next topic. So that will go out both on the website and the Casper Pride newsletter. And then the only other, I spent the first part of this week in Cheyenne at the Governor's Conference for Tourism and Hospitality. So industry folks from all around the state were there, and it's an annual conference that I attend. So we got to advocate on behalf of that Wyoming's second largest industry. So we had a productive visit to Cheyenne around that particular industry. And then Pat pretty much covered the presentation last night, but really enthusiastic about the Casper College's initiative around this community learning series. I think it's great. I think it provides a lot of opportunity. So far, there's already been a relatively diverse set of topics, and they're sort of just getting started. So I think we can expect more community learning there that I think is really beneficial to us. So looking forward to continuing to participate with them. So thanks for the invite for that. And staff has been mentioned. Not only did they attend, but also helped us prepare that presentation pretty significantly. And so thanks for everybody. I think everybody except for maybe Krista, who ended up getting looped in on the running thread. We kind of reached into many departments over the course of preparing that presentation. So thanks to everybody who hopped in and helped us fill in the gaps so that we were delivering all the information to the folks there, and to the other counselors for joining us. And that's all I have.
Thank you, Mayor. There was a Metro Sit Rep report last week. I'm glad to see those are actually in our information packets. Most of y'all already saw this, but in the case you didn't, and just for the public's awareness, recently had a parvo outbreak out there, and really tough on the staff. They've also recently received some cats and dogs that were severely malnourished, in bad shape, enough so that some of them needed euthanized. And so it was just a helpful but stark reminder that these people, who I imagine all love animals, do have to handle some really tough cases, make some really hard decisions on a daily basis. So thinking of those guys up there, thankful for them and the work they do, as well as the support and collaboration of all of our partners and volunteers that assist that team. Appreciative of all y'all's work. Went to the Yellowstone apartment ribbon cutting last Friday. It was a nice reception, got a great tour of the building. Really good turnout, and it was great to be able to walk through the space. Had a Old Yellowstone District Committee meeting yesterday. Our March 17th meeting of council will see applications for renewals of 2 member terms and acceptance of 2 new applications. The existing that are looking for renewal are Kelly Ivanoff at Wyoming Plant Company and Philip Rail with State Farm Insurance. And then the 2 new applications are for Lindsay Grant at the Lyric and Marty Axon with Brick and Bond. I want to thank Jamie at Nolan Feed and Pete Maxwell with Gaslight Social and Rialto for their service on the board. They've just got a lot going on, and so that's why they chose not to renew. But looking forward to welcoming Lindsay and Marty. And again, you'll see those applications all on the 17th. We did re-elect leadership for that group, myself as the chair and Laura Hunter from My 321 as the vice chair. So we'll serve in those roles for the upcoming year. And then, yeah, people already mentioned it. I was thankful for the Casper College's invite to do the learning series last night. Was happy with the turnout. Always wanting, I always want a full room, but I think we probably had 40 people show up. And so it was nice, good questions, good engagement. Their next one, I don't think they've announced the date or time yet, but they said it was going to be Tammy Salisbury, the county assessor. She's going to be talking property tax. So again, just thankful for them putting on this learning series. I think they've been coming up with some really interesting programs and would encourage folks to check those future ones out. If you missed this one, I know they've posted videos and I saw a video crew there last night. So I imagine they got a Casper College Learning Series webpage that I haven't seen the past couple videos on there, but I imagine at some point they'll post that video. But if you were interested in the presentation materials or anything that we covered, I've already sent that out to 1 or 2 people that were unable to make it. So hit me up. That's all I got. Thank you, Mayor.
As Brandy had mentioned, we've been meeting with the Lark. A lot of us have, and so they are actively starting to work towards moving in the direction of building a actual performing arts center. So we've listened to that, and so just wanted to put that out there that that's kind of coming down the road. And I think we've all listened to that. It's very exciting what it's going to be, what it could be, some of the revisions. So we're looking forward to that. So others, I had a great opportunity today to meet with the 4th graders at Lincoln. Had a great conversation with them. They challenged me quite a bit. Asked me some very hard questions. And, you generally get what's your favorite color and, what do you do? But these young people asked me very hard questions around education, the city in regards to immigration. They even asked me in regards to that, equity, understanding how people are treated in the community. And so I was very impressed. They asked me some very hard questions. And so I was very grateful to have that conversation with them. Very meaningful, to be quite honest with you. So anyway, very much loved it. My wife works there. She teaches in the preschool. And so she gets firsthand account of that school. And it was just wonderful young people. Lincoln Elementary. Yeah, just very, very good. Let's see, I'll be speaking in Concrete Association of Wyoming on Thursday morning. So I'll be doing that. Looking forward to doing that. And then I think that's about it. So that's all I got.
Can I add?
Absolutely, Pat.
So I just wanted the surface water drainage utility was Senate File 116. And I really appreciated the active participation that WAM put forward in really working on a lot of key issues. But this one, they really had to work very hard at, and that voted basically against us were Senator Boner, who's got Evansville as part of his district. Cale Case was Gary Crumb's bill, Senator Crumb's bill, who I like a lot. But Hicks, Hutchings, Senator Ide from here, Colt from Rock Springs, Larson from the Powell area, Love, Pearson, Charlie, Scott, and Steinmetz. But the rest of our senators voted with us. So appreciate Senator Barlow's help and others' help at some point. But that's WAM at work. It's invaluable to our legislators. whether they realize it or not.
Return on investment's very good.
Yes, yes.
Awesome. Well, thank you, everybody. Appreciate it. Have a great rest of your week.
No executive session or?
You're off the hook. You're off the hook.
What are we gonna do with our early evening?